Hey y'all, welcome to this week's episode of the One Hood Power Hour. We'll be doing another special episode this week with our topic being centered around World AIDS Day and all of the different issues and topics that are interconnected with that. So we're excited to welcome some more exciting guests to focus on that topic today. Welcome to another episode of One Hood Power Hour. We've had a lot of different developments recently. The county budget is officially being voted on tomorrow and has basically been finalized thus far. So we'll see, once all of that is released, we'll see how all of that breaks down. Should be several interesting developments there. With the passing of the last holiday and the incoming snow, it's officially Christmas season. I had to bring out the Roots Christmas sweater. Uh, so that is a little piece of optimism for me, at least. There's one bright point to emphasize for this show. um so welcome to another episode of the One Hood Power Hour.
Yeah, I know a lot of people are probably upset with another announcement that the Steelers Ravens game has been delayed. But that just a reminder that these COVID cases are going up and that people need to be reminded to be safe, to practice the CDC guidelines, and to make sure that they are not coming into contact with people who are not social distancing or not wearing masks, because like COVID here is real. In other news, once again, Pennsylvania has basically certified its election results. And this never ending, ongoing litigation saga that is like our Pennsylvania 2020 elections. We just had another lawsuit basically come back and say that Act 77 was constitutional, and we can go forth with certifying our results. So we're going to think that now we won't be having another recount. We won't have another election. We're good to go here in Pennsylvania. We do have, the Senate race here in Georgia. It's still pending, so you have until December 5th to register if you're in Georgia. But it's a lot going on. I used to remind people with the snow, there's still seasonal affective disorder, so make sure you're practicing self-care. Just make sure you're out here just being okay. We know COVID, it's a lot to handle, and especially during this holiday season. So just please, be careful. Do what you got to do to survive. We have the county hearings. We have the city budget. We believe it's going to be sometime next week that we're hearing. So make sure you're signing up to give comment about the budget, and to ask, the city of Pittsburgh. A lot of people have been organizing around Stop the Station, defunding the police, and having paid sick leave. So you just want to make sure you're reaching out to your city council, just to give your input and feedback. But like Ryan said, we had a really great show today, and we're very excited to go ahead and get that started. And so for those of you who are not aware, tomorrow, December 1st, is International World AIDS Day. This is a day of basically solidarity, compassion, support, education, where we acknowledge not only the people that are no longer here due to HIV and AIDS, but we're celebrating the people who are still here, the medical breakthroughs, the communities that have been created, and basically getting rid of the stigma that comes along with people with HIV and AIDS. And so that's why we have, World AIDS Day, and we're joined by our illustrious director, Kari Mosley, who's already still more fashionable than Ryan or I could ever hope to be. Sorry. Ryan with his roots. He has his roots. Picnic, Christmas.
Festive for the season.
Of course.
Yeah. So we're just getting ready to bring on our guest. So today we have a very special episode of the One Hood Power Hour by some really cool organizations. I don't know if you were able to see the flyer before you came on today. We have True Tea Pittsburgh. We have Project Silk. We are very fortunate also to be partnering with the organization called Human Services Center Corporation out of Turtle Creek, who's all going to come to us, and we're going to have a really interesting and in-depth, informative conversation. We have from Project Silk, Chaz Cheatham, who is joining us. We also have from Project Silk, the program director of Community Human Services, Jess, who is joining us. And then I do believe we have Dwayne from True Tea, who is also joining us. And then we have questions. We also have Abby from Human Services Corporation, who can talk a little bit about the working group that's going on at the county. So welcome everybody to the One Hood Power Hour. How are y'all doing this evening?
I'm doing good. It's good to be here. Thank you for having us.
Yes, likewise. It's great. It's great to see everyone. Peace to Kahari Mosley. Good brother
Peace.
there.
Good
Everybody else. Good to see you too, bro.
So just from a starter, can you just talk about what is World AIDS Day and what does it mean to you and the work that you do here in Allegheny County? And we can just go through one by one. Chaz, if you want to start.
I knew you was gonna pick me. For me, World AIDS Day is really special because in my youth, I lost someone really special to me to HIV, and it was in the 90s when the AIDS epidemic was extremely terrible. The medicine technology wasn't as advanced as it is now, and I literally watched my godfather shrivel away down to a skeleton with skin barely fitted onto it. And so to have this time of remembrance, to remember all of the people worldwide who are not only people who have passed away from AIDS, but also people who are living with AIDS and HIV who continue to be in the struggle. And the work that I do is directly connected to my relationship to World AIDS Day, which is I work for an organization, and our main goal is to connect people who are living with HIV, who may or may not know they're living with HIV, to a care continuum so that they can get healthy and hopefully get on the path of U equals U. And then folks who do not know that they have HIV, who may be living with it, or AIDS, to get them connected. And also HIV prevention, to educate folks about how they can prevent HIV every day, and STIs also, because it's not just HIV. Thank you.
Thank you for that. Jess, do you want to go?
Sure. Thank you for detailing a little bit about Project Silk in your description, Chaz, and for being so open about just your personal experience that you have and your lived experience. For me, celebrating World AIDS Day and recognizing World AIDS Day is very important. But I do think these are conversations we should have, all year round. I am so thankful that there is a specific day where we honor those we have lost. That's how I look at it, honoring those we have lost, but also celebrating their lives and celebrating all of the work that has been done to provide different services for those who are living with HIV, and to provide wraparound services. So Chaz mentioned preventative services for those who are negative, but also providing those wraparound services for those who are positive. And yes, that includes medication and regimens and things of that nature. But it's also looking at, the support system for that person and the community for that person. And Project Silk, where I work and service director, we strive to provide a safer space for LGBT communities of color, and we strive to provide a space where folks can celebrate themselves, 365. So I mentioned that because it kind of goes in tandem with my thoughts about, World AIDS Day, and having friends in my personal life that, are living with HIV. And as Chaz mentioned, our virally suppressed and our quote unquote U equals U. It's a day to really celebrate that, and really be intentional about that celebration. So I think that's my take on World AIDS Day and why it's so important.
Abby, do you want to go? And then Dwayne, you can follow Abby.
Sure. So to me, World AIDS Day, I think is really important to remember those that we've lost, but also to celebrate the advancements in care that have been made. And just, it's a day of just awareness. So the HIV and AIDS working group really works to raise awareness about HIV and AIDS. And a lot of people don't realize that HIV is still prominent in the world, so they don't really realize that it's still out there. So I think having this day dedicated specifically to remember HIV and AIDS and just raise the awareness that it is still out there, but it's a lot more manageable these days, and people who are living with HIV, can still live long, healthy lives. I think that's really what it is.
Dwayne, you're on mute.
Dwayne, can you hear us?
Can you hear me?
Yeah, we can hear you.
Yes.
Oh, I'm just blabbing,
Yeah,
y'all. I'm
you're
sorry. What I was saying is I'm
No
basically
worries.
echoing Chaz, Jess, and Abby, what they said prior. But for me, World AIDS Day, again, is a day of celebration. I'm looking forward at all of the breakthroughs we've made in medical, as well as building community and educating everybody around that. But it's also a day of remembrance. And for me, I remember coming into my comfort with identifying as LGBT or gay, and looking for the elder generation to kind of guide me, and they weren't there. And the reason they weren't there is because of this AIDS epidemic that was here, for the generations prior to me. So it's a beautiful thing that now today you can live a safe, healthy, effective life with HIV. And I think that all of us on here, we kind of fight this battle. We do this work 365 days a year, right? So it's nice that we get one day in the year that the world can kind of celebrate with us and learn and educate themselves too. So that's my take.
And so one of the things I know you mentioned at the very beginning that people don't understand that HIV and AIDS is still here, but what does it look like for people who are living with HIV and AIDS while also trying to battle this COVID pandemic, and how has that impacted the work that you're able to do in the county?
Is this an open question for the floor?
Yeah.
Cool. Sorry. I can start. I'll keep it pretty short. I think something that a lot of folks, a lot of clients, that's what we call our members. We don't say patients, we say clients, but a lot of our clients who are positive, HIV positive, it's been isolating for a lot of folks. And folks have been able to, that I spoke to personally, have been able to, still attend appointments and still have their regimen. But the social aspect has been very detrimental. And I think it's important that we shed some light upon that, because oftentimes, people talk about your physical health so often, and it's very, very important, yes. But your mental health is also very important. Mm-hmm. And when you're isolated and can't connect to your community, like we're not open right now, we're opening only for appointments. And such a big part of our program before COVID was that we were we were a drop-in center, so people could come in literally whenever, no appointment needed. And we work with younger folks, 13 to 29. So that social aspect has been detrimental for folks. And we try to do virtual workshops. We do a really great virtual workshop with True Tea, actually, called Silky
Good.
Thursday, which is great, but it's not the same. So that's my take on it.
Mm-hmm. I would have to agree with you, Jess. I definitely think that there are resources within the city from different organizations to help people to get transported to and from their medical appointments. And, we can get you food and hand sanitizer and all those good things. But the mental health is something that is lacking. And when you are stuck at home on COVID restrictions and you can't interact with people, yeah, I think that does something to you. We actually at True Tea, we have a safe space group called Power Hour, similar to this. However, it's a safe space group in conjunction with Central Wellness Outreach Center and Allegheny Health Network for folks who are HIV positive and or want to be better connected to the community. It happens every first and third Wednesday of the month. And that normally is an in-person event. We see anywhere from 10 to 20 people from the community every 2 weeks that come in and participate in that. And because of COVID, we have had to get creative and move things to the park sometimes to make people feel more comfortable with the outdoor space. And then we've also had to adapt virtual. And like Jess said, the virtual component it's just different, And now that it's getting a lot colder outside, we can't necessarily go to the park. So I definitely think that's a conversation to have and bring more visibility around. Oh my God.
Oh, the Chihuahua is fine.
She's just gonna keep coming.
You can hold it. Listen, T'Challa is like right here, just about to like. You will see him by the time the show's over. But Abby, can you talk a little bit about the working group? What is the working group? What is some of the work that y'all are doing, and how can people get involved to support this work if they're working with similar populations but aren't a part of the working group?
So the HIV and AIDS working group, it's coordinated through the Human Services Center. Our main goal really is to raise awareness about HIV and AIDS. So we do a couple different events throughout the year. We have, let's start at the beginning. So Women and Girls is in March. That's Women and Girls National HIV and AIDS Awareness Day. So what we have done in the past is we've done a dinner in March, and we invited a bunch of different organizations to come in if they want to participate, and then they listen to speakers. So we brought in speakers who are living with HIV, and they've given a personal perspective. Last year, we had a couple different groups. We had Planned Parenthood, the Health Department, Allies for Health and Wellbeing, and some other organizations come in. They set up booths, and then the participants went around and they talked about different aspects of sexual health. We also do Project Heart in the summertime. So that's for students age 13 to 17. We have them come in. It's a 7-week program, I believe, and they learn how to become peer advocates. So they learn about HIV, other STDs and STIs, and they learn how to become peer advocates. So if they're peer educators. So if their friends at school have questions about HIV or other sexual health questions, they can come and talk to them about it. And the students who have participated in our program can help them figure out where to look for accurate information and maybe even answer the questions without having to go look it up. We also do the walk every October. So we have the Mon Valley HIV and AIDS Awareness Walk. We just celebrated our 20th year. We had to do it virtually this year, but it was really cool. We still had a lot of people participate. And then the funds that are raised from that event go to support the other events that we do throughout the year. And then the last event that we do is World AIDS Day. So normally we're out in McKeesport handing out hot dogs and condoms and HIV information and resources. We do a chili cookout occasionally too. So that's really fun. But yeah, our main goal is to raise awareness about HIV. We have different organizations on the working group. So we've got people from Allies for Health and Wellbeing, Macedonia Face, Monyac Community Services, Latterman Family Health Center, AIDS Free Pittsburgh. We have a lot of people. If anyone's interested in joining, please let me know. We'd love to have other organizations. And I can Miracle, can you send out my email? Is that possible to share with everyone?
Yeah, we can do
Okay,
that.
yeah, if you want to do that, if there's an organization interested in getting on the working group, please contact me and we can talk about that for sure.
Awesome, thank you for that. So outside of, and this is like an open question to the whole panel now. Outside of getting involved directly in that working group from the organizational standpoint, what are some ways that individuals or other smaller organizations can get involved in participating in World AIDS Day this year, especially given the pandemic disrupting a lot of maybe the more traditional in-person events. So any sort of way, whether it be commemorating, raising awareness, remembering people, what are some other ways that people can get involved this year?
So I'll do a quick plug for AIDS Free Pittsburgh. Y'all, I talk a lot, so somebody else please jump in or interrupt me. But AIDS Free Pittsburgh on their social media, I know on their Facebook, and probably on their actual website, they have like a little form or whatever that is listing virtual events that are happening all week long. I think there was actually maybe even an event or two tonight, but there's definitely stuff tomorrow. And Project Silk is actually doing a World AIDS Day, Silky Thursday, in collaboration with Tutti on Thursday. So there's a lot of virtual events floating around.
Yes. I actually just found the email, Jess. So if y'all want, I could just read a couple of them for y'all real quick. But tomorrow, they're all tomorrow for the most part, and Tuesday. But there's a World AIDS Day with Macedonia Face from 9 a.m. to 5 p.m. Online. There's also the Pitts Men's Study is doing a World AIDS Day, a memorial event. There's the AIDS Memorial Quilt virtual exhibition with the National AIDS Memorial Organization. There's also the Trauma and Time of COVID and HIV World AIDS Day 2020 conference, the Mid-Atlantic's AIDS Education and Training Center. And that is actually December 1st and 2nd. And Miracle, I could share these links with you, or Jess will share them, and we could disperse to the public.
I had a quick question. One I had a question for Chaz, and then a specific question for Chaz, and then a broader question for the group. Chaz, as you mentioned, you've kind of watched over the last 20 some years or even more, how how society and the culture in general, has been impacted, as well as has responded to AIDS and the epidemic, starting in the early 80s. Can you just talk about, from your perspective, how things have changed, and then for the larger group, what lessons can we learn, from the AIDS epidemic and pandemic, over the last 40 years, to address the current pandemic that we're in, and what are maybe some of the mistakes that were made back then that we see are being replicated today, that we may need to avoid as we go into what we at least perceive to be a very rough period over the next 2 months.
Yes, sir. One of the first things that really comes to mind, Kahari, in terms of how things has changed, or maybe one of the larger things, is the medicine. Because in the early 80s and 90s, if you were positive for AIDS or HIV, at that time, it really was a death sentence. I can vaguely remember that there was just a couple of different cocktails. There were lots of pills that people were taking every day. It was making them sick, and it was not as effective as medicine is today, where 30 years later, you can get on a medicine, get on a regimen every day, and you can live with HIV, live out a full, healthy life. And so U equals U, which the medicine can get you to a place where you're undetectable and untransmittable, which means that your levels of HIV in your bloodstream are so low, and you cannot pass it to another body. And so that is a 180-degree turnaround just from then to now. And then I think stigma is a little bit different now. There is still stigma associated with the LGBTQ community in general, whether that stigma be, based on religion or, just myth largely, or people just being ignorant and having prejudices that are unfounded. I guess that's I didn't mean this. It's a double statement, but in terms of things that are different now, I think stigma. I think there was a time when people thought that you could get HIV from someone perhaps breathing on you or sweating on you, or through transmission of other bodily fluids that we now know that you cannot. I think there was also a time when people thought that the HIV virus was small enough to pass through the holes in a condom, and so there was a lot of myth around the community that condoms didn't protect against HIV. Like, these are all things that I remember. And even at that time, there was still stigma around talking about safe sex in high schools to young people who were no doubt probably having the most sex. And so maybe after a short time, some of these things had changed. There wasn't at that time. I don't know if people were saying they were born gay. People were still saying that, and I mean, people on the outside of the community, being gay is a choice. If you're gay, it's because you chose it, not because of anything else, or because, on religious lines, like you have a demon or a spirit, or you've been molested, or something like that. And a lot of that stigma has changed with education and with the presence of more LGBTQ people speaking out, writing books, being teachers, mentors, professors, just educators, people who work in the medical field, who support and help folks who are living with HIV or folks who are just in the community, etc. But there's a lot of things have changed. And at the same time, brother, a lot of things have stayed the same,
Right, and yeah, and for the larger panel, like if we could just do a quick round robin and just talk about, just from your own, knowledge and history of how, and in the early days, the AIDS epidemic was dealt with. What were some of the lessons that we can take, for this current pandemic? Maybe what are some of the mistakes that are being, I think even some of the things that Chaz just said, you could see, masks don't work. You could obviously, take out the statement Chaz had just made, said back in the day about condoms not working, and just put masks in there and just see how 1980 something and 2020 isn't that different, but coming from your much deeper reservoirs of knowledge about this issue, can you talk a little bit more about what we could learn from the 1980s as we go into 2021, which appears to be at least for the next 6 to 9 months not much different from the last 6 to 9 months.
Yeah, I mean, I think for starters, back in the day, HIV and AIDS was associated with being LGBTQIA of some sort. And I think that with the COVID virus, a lot of people kind of began with that, like, oh, Black people are immune to the virus, or, oh, if you're, I don't know, they were saying all these different segments of people were immune from the virus. But I think first, educating ourselves and realizing that this is something that anyone can get, regardless of your race, gender, sexual orientation, if you're a top or a bottom, whatever, anybody can catch COVID-19. I think starting to learn to trust science is important, and not just going off of myths and hearsay of, what we're experimenting in our bathrooms and whatnot, or what our former President Trump is saying on TV, but trusting those that are experts in this field. And yeah, that's where I'm at right now, I guess, with that. Yeah.
Anyone else want to jump in?
I don't have much to add. I mean, I really don't have anything to add. I'm not just gonna ramble. Y'all explained that really well. I think stigma, though, maybe I'll say, just reiterate that again, because y'all have already talked about that. I think stigma is something that has definitely decreased since the 80s, as you were saying, Chaz, and how, as you mentioned, Naheen. But at the end of your statement, Chaz, you also said, and things have still stayed the same in some regards. So it's changed, but in the same breath, and I sigh, so dramatic, but it's true. In the same breath, it hasn't changed that much when you look at stigma. And in some ways, I feel as though the stigma has expanded or increased for people of color, specifically Black and Latinx individuals. I think we're doing work on that now. I think a lot of the people next to me on my right and my left, I don't know if that looks like that for everybody else, are doing great work. And so are a lot of other organizations outside of this state even, to decrease that now. But when I look at my bubble, you know, of where I work, and I work with a lot of Black youth, I work with a lot of brown youth. And we have some very intimate conversations, and I appreciate that. But through those conversations, I can clearly see that that harsh stigma is still there. And it is literally the cause of a lot of newly diagnosed individuals, positive diagnosis, if you will, which is treatable. So I'm not saying that is as it used to be, but it is the cause, because people feel like, well, if I get tested, somebody's going to label me this. Or if I say I'm having sex with this person, somebody's going to label me this. And we have labels for everything. You know what I'm saying? We really do. But it's the connotation that is behind those labels. It's the connotation that society puts behind those labels. And that is where I think a lot of work needs to be done. And I'll leave it at that, because y'all know I can be long-winded.
That was good.
Yeah, because I was like very excited to have like Girlfriends come back on Netflix, right? And I was watching the show, and there's this very infamous episode that talks about like HIV and AIDS, and it basically parrots like the whole like down low saga storyline that I feel like we haven't held Oprah accountable for. But you know, put that aside for a little bit later. And so here in 2020, what are some of the myths that you're still seeing that like are still there and are kind of like barriers to people A, getting tested, but also B, getting treatment, right? Because we still have perceptions of about who can and cannot get AIDS and HIV, and how AIDS and HIV are spread, you know, still in 2020.
I'm sorry, Miracle. Just ask that question one more time. Just please repeat it.
Yeah. So what are some of the myths that you're still seeing show up like in your work around HIV and AIDS?
I think I'll go real quick, I promise. I think one myth actually comes with prevention. We do a lot of conversation about PrEP education, linking people to PrEP, that sort of thing. A lot of folks are very confused about what PrEP actually does, like how it actually works. And there's myths that like it will make you sick. There's myths that it doesn't even help you, doesn't even help prevent HIV rather. So there's myths that I hear like that from folks sometimes. There are still myths that I don't even want to get into that. Never mind. There's just a lot of myths, but I'll just keep it to that one.
I think there's a lot of, there's nothing really new, you know, like human beings have been having sex and experimenting with their bodies since the beginning of time for millions of years now, I'm gonna imagine. And so I think that it's a lot of the same, which is, you know, folks who, for some reason, they'll start off with the condom on, and they'll feel safe and responsible. And then at some point they take the condom off. And I think somewhere in their mind, they think because they started with the condom that they're going to be safe. I think in regards to PrEP, I think some folks with PrEP are not still using condoms because they know that PrEP protects against HIV, but they are taking that as they're extending it to gonorrhea, syphilis, herpes, chlamydia, hepatitis. when it does not cover those things. And these are not necessarily myths, but these are behaviors that I see people doing in a lot of people. It's not like, just a few people. And then people who still are like, sex is better without a condom. Not like it doesn't feel better, but the peace of mind isn't necessarily there. And so people are still kind of playing around with that sort of balance of taking a chance, the pull out method or something.
Yes.
Naheem, what you think?
No, I agree. The pull out is one myth that I hear regularly. Yes.
I think there's also just still confusion about HIV not being AIDS. I just had a conversation with one of my friends the other day, and it was very enlightening. And they just expressed that, like, when people say HIV AIDS, it's very disheartening for me personally, because it equates that if you have HIV, then you have AIDS, and these are two very different things. So I think there's myths even there. Like, if you have one, then you have the other. Or if you test positive, some people still think it is death sentence. And I don't like to say that phrase. Really, it doesn't sit right with me for some reason. But some people still think it is what it was in the 80s or the 90s. And, as you were saying earlier, Chaz, some people still think you can, if you share a cup with somebody, you can contract HIV. Like, I got my mug in case I get thirsty, but if we were to share that, like, one could contract HIV. Or they think only certain communities have HIV. That's not true. Or only certain races have HIV or ethnicities. Or they think the whole continent of Africa, and I'm not even being funny, has HIV, like, spread throughout. Like, they'll say, oh, in Africa. I'm like, that is one giant continent with many, many countries. And we don't know, people don't even know the statistics, you know what I'm saying, when they make those blanket statements. And I think a lot of the myths lie in the ignorance of these blanket statements. And I don't want to be like, have a combative tone because, to decrease ignorance, people need to be educated. So I'm not shaming folks. But I think that's where some of the myths lie, though.
Definitely. And also the myths around people automatically assuming because you're HIV positive, you got it because you're a whore and things like that. When some people are born with it, someone might have been raped. There are lots of different scenarios that put people in that situation. So, yeah.
And just to back up, just guess maybe a 7th grade introduction. We can back up. What is HIV? What is AIDS? And how is it spread? Since we're talking about, the education, the lack of education, can we just answer those questions and then just talk about reintroducing what PEP and PrEP is for some of our viewers who may not be aware?
Am I going? Yeah. So I will just go ahead and read you a little something. So the difference between HIV and AIDS is pretty straightforward, y'all. HIV is a virus, whereas AIDS is sort of like the definition of that virus. You cannot have AIDS without being infected with HIV. However, people can live long, healthy lives with HIV without ever developing AIDS. HIV stands for the human immunodeficiency virus. So basically meaning that you can contract the virus of HIV. And like Chaz and Jess have said, there are medications, there are PrEP and different things that can help to get your T cells back to normal so you can become U equals U, undetectable, untransmittable, which can prevent you from ever contracting, I guess, what the full definition of AIDS would be. So it would be a manageable virus. Does that make sense? Yes. Okay. And what was your second part of the question, Miracle?
How is HIV spread?
Yes, so HIV is spread by unprotected sex. Literally, just like the coronavirus, you mask up. Like it's the most simple, the most simple thing. And then there are even extra precautions, like we've been talking about, which is PrEP. And PrEP gives you a 99.9% chance of having a greater opportunity of avoiding catching HIV without the use of a condom. Though you should still use the condom because there's still that 1% chance, and there's still STIs and other things that you can contract in the process. But it's literally that simple. Wear a condom until you and your partner are secure, married, comfortable. You know that is your one you want to have kids with, and you're locked down. Wear a condom. Like, I think it's
And that was like perfect, Maheen. Thank you for reading
Thank
that.
you.
I just no, like for real, it was perfect. It was to the point. I just want to add, like, needle sharing.
Yes.
You can also transmit that way because of blood and things like that. That is, I don't even know about the data around that right now, just because COVID has been like this weird like bubble and there's just so much going on. But I just want people to, remember that like sharing needles is also putting you at risk. But there's places you can go to get clean needles, like Prevention Point, needle exchange programs. There's a lot of stuff being done on like a legislative level to, I think, create more needle exchanges and things of that nature. I can't really speak to those super eloquently, so I won't. But that's another way that you can decrease risk by not sharing needles and like making sure you get clean needles. And it's important to educate people about that and not shame people. Naheen, I really liked how you explained that, because I don't know, like it just like reminds me like of not like making sure people know like you don't want to shame people, you want to educate people and inform people. And when we have platforms like this, like you want to explain things in a way that you just did, Naheen, like which is informative and takes a harm reduction approach. So it's not like
Thank you.
talking about like stop having sex, practice abstinence, or don't utilize needles, don't do that at all. It's like how can I have sex in a better, healthier way? And if I am utilizing needles, where can I get them like brand new so I don't have to share them?
Yes. I think, yes, it's so important that, especially in today's times, like we can't force anybody to do anything. All you can do is give people the tools and educate them so they can use them properly, right? And I think that's so important. Like I can't tell someone to stop escorting, but I have no solution to how they make an income or how to get around transphobia at their place of employment and things like that. You know what I mean? But what I can do is provide you condoms and give you safe tips and tricks on how to stay safe. You know what I mean? Like, yeah, I just think, stop judging folks.
Yeah, I think it's also very important because time of COVID, a lot of people are also sharing needles for medication because they don't have the financial wherewithal to make a doctor's appointment every day because stuff is shut down, people aren't working. And so when we're talking about providing needle exchange programs, there are a variety of reasons that people need clean needles for whatever they have to use them. So again, I think it's very important that you bring up those resources. And I know that it's one of the ways that you mentioned earlier, and I think that people, could be born with HIV. For people who are pregnant and believe that they're HIV positive, or have come into contact with someone who is HIV positive doing the work they may be doing, what are some resources that are available to help them during their pregnancies so that they and their baby can remain safe and healthy?
Yeah, so I'm not as informed with those resources, but I do know that there are opportunities at Allies for Health and Wellbeing. They do have some services around that. Our good friends at Central Wellness Outreach Center, they also are pretty adaptive, and they have lots of resources for even folks outside the LGBTQIA plus community. And I would believe, and someone correct me if I'm wrong, but Planned Parenthood, I believe, has some sort of resources around mothers and HIV. Am I correct?
Yeah, you're correct. Planned Parenthood, and then I believe no, you're good. And then I believe Adagio Health would be one to add to that list that can do similar things to what you shared.
Yes. And then, of course, as far as safe spaces and things like that, there are places like Project Silk where people regularly occupy as a sense of community and family. And to be connected to other resources. So there are lots of organizations in the city that, though we might not specifically offer the resources, we can connect you to the right resources. And if we don't have the answer, we'll help you figure it out as well. So those just some of the folks I know of, at least right now.
Thank you. Yeah, I appreciate you providing all that info. So I just had a question regarding one of our listed discussion topics for this show, which was factors that put communities at greater risk for HIV. So obviously we've talked about, the pandemic being one of those factors and exacerbating a lot of those different factors. But, with World AIDS Day being tomorrow, I wanted to give you all the opportunity to spotlight any, especially pertinent factors, as well as how we can spread awareness on World AIDS Day to address those factors through, different public health initiatives or other ways of addressing that.
To me, the biggest factor is get tested, know your status. If you are negative, live your life with safety and have better sex by getting on PrEP. Use condoms. HIV is not a death sentence, but you can still be safe and you can protect yourself and you can avoid causing yourself an extra thing to take care of. Get tested, know your status, get healthy. Because all those things are possible, whether you're positive or negative.
Exactly. Yeah, I would say some of the factors or barriers that are holding folks back right now, off the top of my head: transportation, housing, food. People have to do things to sleep at night sometimes, which can put you at risk by sleeping with someone who is HIV positive, to have a place to rest your head, things like that. So what can people do to assist in, I guess, fighting against some of these challenges? I would say educate yourself around the different organizations, individuals, and people who are doing things in your community, fighting this fight 365 days a year, and support them. Because a lot of these organizations are grassroots organizations that don't get the recognition that some of the bigger organizations do get, but they are doing just as much work and can use your support to reach larger audiences as well. So do your research, see who are already doing the work in your neighborhood, how you can get connected to the work that they are doing in the different communities and populations. And I say build from there. The work is all about meaningful relationships. We don't do this for stats, for numbers, for money. You have to be genuine about the cause. And I think that is what's lacking as far as organizational support.
I don't have a ton more to add yet again, because I keep going third, which is kind of nice and convenient. But I feel like Chaz and Naheen really spoke what was on my heart and in my head. I do want to say racism is a direct cause of a lot of these outcomes. I do want to say systematic oppression is a direct cause of a lot of these outcomes, a lot of these barriers, if you will. We don't have time to break down why that is, because I know our time is limited here. But I do just want to be intentional in mentioning that, because a lot of barriers to housing, a lot of barriers to not just food, but healthy food. Corner stores have food. Liquor stores even have some candy in them that I guess you could say is food, but healthy food. You'll find that a lot of that only happens in certain neighborhoods. And a lot of those neighborhoods happen to be Black and brown neighborhoods. And that's not by mistake. So I think a lot of it has to do with thinking about the structure in which all of these things that we're talking about lay within, and thinking how it is inherently corrupt, if you will. I hope I'm not saying too much or going off rail too much, but that's just, I think, another part of this as well. And I'll leave it at that.
Yeah, you're definitely not going off topic, because Pittsburgh is very anti-Black in its policies and in its implementation of certain services. So you're definitely not going off a script at all. And we're talking about these systems of oppression or as like Dr. Bay says, these social determinants of health, we understand that race and racism play factors into these health outcomes. So what can we be doing as supporters, as allies, as accomplices, as organizers to raise awareness and to make sure that we are creating systems that are moving away from oppression and these colonized systems?
Well, we just finished voting, so I hope we all did that. But that has a big deal. Voting is a very good way to create some change. And it's not just the gigantic election that we just went through. It's the local elections too. So participating in things like that is important. I haven't been to a city council meeting in a long time, so shame on me for that. But attending meetings like that can be very useful. Getting to know your neighborhood and like who actually lives around you, and getting to know your community and who lives around you, and who does not live around you. I live in East Liberty, so it's important for me to know who does not live around me too. And I'm a transplant. I'm not originally from Pittsburgh either. So that can also play into your outcomes that you have as well. That's why I add that. So I don't know if I answered your question, Miracle. I'm sorry. But I think that those are some ways that can help with those things. Not those things, but those topics that were previously mentioned. Naheen said earlier, uplifting and celebrating grassroots organizations is a huge way to help support in a way that looks to end these barriers and looks to take down these systems, supporting grassroots organizations. I like to celebrate who's on screen. So supporting grassroots organizations like True Tea, supporting grassroots organizations like Project Silk, where I'm very privileged to work, if I do add that as well. There's a lot of other organizations and programs too. There's a ton. There is Sisters, there is Trans Uniting, there is Allies, there is Macedonia Face. So I could just go on and on and on. And a lot of these programs or organizations are Black-led organizations. So I think that's important, and that can be a very important place to start. Also, educate yourself about intersectionality. We're talking about LGBT communities a bit here today. I am not a person of trans experience, but I know that oftentimes when I am in rooms and we're talking about LGBT issues, we are not looking at the intersection that exists there, and we are not paying enough attention and uplifting and being very transparent about what is going on with our trans brothers, sisters, and people in general, non-binary individuals. We're not talking about that. And I don't know why, because there's a lot going on. There's just a lot going on. I'm not even going to go on a tangent here, but there's a lot of things that we should be discussing. I'm already on the tangent. I don't know why I'm saying I'm not going to go on.
Good. You're giving us life right now.
We should be discussing though, y'all. Trans girls are dying left and right. It's not funny. It's I'm not trying to make us cry here, but it's an issue, and we're not talking about that. And that too is part of systemic oppression. That too is part of the ignorance that we keep speaking about. That too is part of the stigma that we keep speaking about. So I think a lot of this, it's intertwined, and I don't have the solve for it, but I know that these conversations can be very powerful. And I'll leave it at that.
Yeah, I think that's a great point. We've talked a lot about on this show, particularly, over the course of this year, where we focus a lot about politics and the election. And, one of the issues, that came up particularly, around some of the endorsements that President Trump received from very notable folks in the hip hop community, as well as, the 20% of African American men that voted, for Trump. There was, a small yet be loud, group of folks amongst African American males that were pushing back against, kind of Black Lives Matter, particularly the LGBT voices that were leading, Black Lives Matter, and making this argument, that really, went against this intersectionality that you were just talking about. How can we, continue to push back against, that mentality, that perspective, that, says it has to be one or the other, that somehow LGBT voices from the Black community, aren't, shouldn't be at the forefront, of these issues, and somehow to not look at these issues of intersectionality is somehow taking away, our focus from, African American issues, as if, we can't, address, the intersectionality of it all, as well as gender issues as well.
That's a good one. I'm trying to let somebody else take it.
Me too. I just gave a whole moment. So somebody else.
I'm just going to say a little bit because there's so much that can be said about this, Kahari. In terms of Black voices, and I think the first thing I want to say is that African American Black people are conservative people, and I say this because our ancestors, distant and close ancestors, had to sort of amalgamate into this society in order to fight right. And so there is no way that our ancestors or whoever were ever going to make any progress unless they learned to do that. And so this is where we are in our history, where our older grandparents, like I often say, for myself, I was born and raised in the Pentecostal Church of God in Christ. I don't recall ever being anywhere before I woke up in church. And I was in church my entire life, at least 6 days a week, if not more. And so to realize that I was gay was almost a direct contradiction. And also to look in the face of my elders and my, people who I felt a responsibility to, knowing that they were conservative Black people, and my grandparents. I don't think that if my grandparents were alive, there's a possibility they might not accept me as gay. Okay. And so that I'm using myself as an example of a larger outgrowth of conservatism and hints of evolving evolution throughout the generations. And so I can't necessarily speak for 20% of Black men. I can't speak for those rappers who are multi-millionaires, close to billionaires. It's a little bit closer to home to understand that religion and ignorance and a certain level of conservatism and also embarrassment, because I think that the community has always been around. Gay people have been everywhere Black people have been since the beginning of time, including church, including the mosque. I know I don't mean that in any disrespectful way, but I have to say that any man who wants to be in a religion that's all men, that sounds like the gayest thing ever to me. I'm sorry, and I don't mean that in any disrespectful way, but that's just how I feel. Okay. And I have brothers that I love who are Muslims, and I'm not saying you guys are gay, but I'm just saying, okay, there's a pattern. But just to wrap it up, I just want to say that Black people are conservative, and I think that we ourselves need to educate. We need to be more educated, and we need to listen more, and we need to love more, because your children are gay, and they were born from two straight parents who obviously have a problem with gay people. So, they're really gay, because why would they be anything else? So you all need to learn about the community. You stop saying this, that, or whatever it is. That's not acceptable. Learn what the letters mean, as Dave Chappelle calls us, the alphabet people. Learn the distinctions, and then try to learn to talk about it, because people have sex. And if you're an adult and you can't talk about sex, or you can't talk about gender, if you can't talk about things, you're not mature. You're not an adult. And that goes for parents, because there's a lot of parents who cannot have conversations with their children about things that are really important. And you think that your child, gay or not, can go out into the world and the world will crush your child. So if you don't prepare your child, love your child, raise your child up, build your child up, it'll be on you if you don't crush them first at the house with your hatred and lack of love and ungodliness. Okay.
Agreed.
I agree. I think, yeah, I just agree. I think like a lot of what you said, strangely, not strangely, it's not strange, has a lot to deal with, late at night, deal with why those percentages exist that were spoke of earlier when it came to the outcome of this election and who was voting for Trump and who was not. I think acceptance has a lot to do with it. Not tolerance, but acceptance. And what you're saying, Chaz, about educating yourself is very important. So I just want to piggyback and reiterate what you're saying, because I don't have anything to add.
Well, before we wrap up, I know this has been a hot topic for the past couple of weeks, and can we just talk about disclosure for a moment? What is it? We're talking about like social isolation. So for a lot of people who may not know how to react and to respond, one, why is it that people's status isn't your business if they're not your partner? And two, why is it detrimental and deadly to out somebody for being positive when it's not your business? Because there's been a lot of stuff going on social media outing people. So can we just like talk about that as you wrap up, just about the issues surrounding disclosure?
Yeah, so I think it all comes down to human decency. Like you said, one, it's not your business. So if I had cancer, would you run out and tell everybody I had cancer? Two, you never know somebody's mental health status. So you exposing somebody's health status that is not ready for the general public to be knowledgeable, or maybe never wants the public to know of their status and fear of whatever they might be in fear of, can cause someone to commit suicide. It can cause someone to go into a deep depression. It can cause lots of negative and harmful reactions. And I just think as a decent human, and someone's life and health being the topic of conversation, mind your business. As simple as that. You can also get sued as well, for especially if you are a medical professional working in any professional field and you are knowledgeable of someone's health status and you disclose that, you can be sued. So there are also legal repercussions around it as well. With that.
Yeah, that was kind of what I was going to say, because that's such a long conversation. I was just going to say one's health information is like the highest level of HIPAA when I'm looking at like my work and what I do. So that is a no-go. You don't share that. And quite frankly, as y'all are saying, you should not want to share that. And if you're in this profession, you should get out of it if you have an inkling to share that, unless you're speaking with the Department of Health or something like that, because there's rules and regulations and paperwork that one would fill out when they're learning of their status. And the Department of Health obtains information for certain data and things of that nature. But that's not the same as making a post on social media about somebody's health status or anything like that. But if you get out of the professional realm, I guess, I think one should ask themselves, why am I sharing this person's information? And it possibly might cause them to have an awakening that they should not, in fact, be doing that. There's no reason to ever do that. If one is fearful of, I won't even get into that. There's no reason to ever do that. Health professionals, trained health professionals, there's services, have services that exist that will tell somebody's partners that they might have had. And that's something that somebody who's positive will go through upon diagnosis. There's, there's a service called Partner Services, and they'll take the information and they'll be able to notify partners that the person might have had. So my point is there's absolutely no reason to share that information, because all people that should know that information already would know that information. And speaking to the mental health aspect of it, one could feel extremely naked or vulnerable if that detail about them is leaked out to the public. So there's just no reason to do that. It could really put somebody's livelihood in jeopardy, if you will. And I'm thinking about COVID because there's similar conversations around the COVID virus as well. Like, a lot of folks aren't necessarily comfortable sharing that they have contracted that virus either. So if one can't wrap their brain around, this part of the conversation, perhaps one could look at that in comparison. Not that they are the same thing. We know they're not, but just as a way to look at it.
I think it's also important to think about, you don't know how that person's family and friends are going to react either. So keeping that in mind, maybe there's a reason that they haven't disclosed it. It's none of your business, obviously, but maybe there is a very specific reason that they haven't. And maybe they don't have the support there. They don't feel like they have the support there. So it is really private. And it's definitely up to the person to disclose if they choose to do so.
I feel like there's a lot of meanness involved with it. I think sometimes people know that you can create stigma around a person or a personality, and so they will lie and say perhaps that a person is HIV positive or something. And it's just as difficult to say, hey, they're lying on me, as it is for someone who is positive perhaps to maintain their anonymity too. Because people are like, oh, people will believe me because this person is gay, or people will believe me because of this, or this person looks, and so I think sometimes people just do it to be mean, because that is the only reason, and especially within the community, how would someone even know your status to say? So it seems like it just comes from a mean place too, of people just wanting to create, a situation where there will be stigma around a particular personality or person, life, group. And that's the only reason.
Yeah, most definitely. No, sorry, go ahead.
Go ahead, Ryan. I was going to wrap up, so go ahead.
I was just going to do the same. I just have one last quick question for the panel. So World AIDS Day, one day a year, but obviously the work that you and all your organizations do is year round. So for anyone who's watching this, who may want to get involved with the organization, contact you, support in some way, whether it be related to this work or anything else that your organizations do, what would be the best way for them to do that?
So Chaz, you gotta go for it.
We're Project Silk on everything, right? Facebook, IG, everything is Project Silk, and perhaps Project Silk Pittsburgh, because there's satellite Project Silks opening up now, but we're Project Silk Pittsburgh, I believe, on all social media.
Mm-hmm.
You can also, that was perfect, Chaz. You can also visit CHS's website, www.chscorp.org, and find us in the list of programs, because we are a program within Community Human Services organization.
Nice. And for us, you could visit our website, www.true_tpgh.com, and you'll be able to be linked to all of our additional social media outlets. Otherwise, everything is TPGH on Facebook, Instagram, and Twitter. Right now, of course, for all of us, this week is Giving Tuesday, so give to all of us. Like, that would be great.
Nice.
That would be great.
And then there's also a page on the HIV and AIDS working group and the HIV outreach that we do on the Human Services Center Corporation's website as well. And then we're also on Facebook.
Nice.
Yeah, we'll get all these links together and place them in and place them in the chat. So as we wrap up, we want to thank you all so much for spending your Monday with us. Doing this labor to educate people on the difference between HIV and AIDS and talking about equity within the city and the county. Please feel free to come back whenever you would like. We're here on Mondays. If you ever want to have a conversation or do a different program, delve deeper to any of these topics, please feel free to reach out to us. And again, thank you so much for joining us this evening. So,
thank you.
Thank you for having us.
Thank you.
Thank you. So that was like a good show. We still have a lot left for this week for work, and you can feel free to log off or stay with us as we close up. So as always, One Hood is always doing things. So tomorrow, Tuesdays at 2, we have our Town Hall Tuesdays where we're discussing equity, Black women and equity in Pittsburgh. So we will have another lovely conversation where we'll be joined with Dr. Jamil Bay, Dr. Cheryl Russell, and if I can pull up our flyer for tomorrow, we'll also be joined by Naomi Ritter, Jordan Hicks, and Janelle Young. So we're just going to be talking about equity for Black women in Allegheny County. Wednesdays, we have our This Week in White Supremacy, Wednesdays at 6, where we're going to be talking about, all things white supremacy, because people still can't get it together in 2020, but we're trying to make it. We're trying to survive. We're trying to laugh and do better. We do Brittany Chantel and Jasiri X both drop music this week, so please, it's Cyber Monday. Jasiri has dropped Rob Jeff Bezos. It is hyperbole. It's not an actual threat for people.
X.
It's so hard being a Black-led organization, and it's just like so hard. So you can go download that on all your streaming services. It is, like Naheem said, Giving Tuesday. So this week, if you have anything extra within your wallet, and your bank account, your Cash App, your Venmo, whatever pay service you have, please donate to local grassroots organizations. COVID has impacted a lot of us, but it has also increased our workload because the people who need our services need us now more than ever. So please, the organizations that you've heard from this evening, One Hood and One Hood Power, please donate as much as you can because we do need your support. And with that, Kahari, do you have anything?
No, I just want to thank our guests for joining us. The human mammals, as well as the canine and the feline mammals that have been joining us as well. Great show. Thank you, everyone. For joining us. Chaz, Abby, Jess, Dwayne. Thank you so much. For joining us, and please join us again next Monday for another great episode of One Hood Power Hour. On behalf of my colleagues, Miracle Jones and Ryan White, this is Kahari Mosley signing off. So thank you for joining us, everyone. Have a great week. Catch us again Monday at 7 p.m.